You know, I am incredibly proud of how the House Democratic Caucus um, has has moved forward. I am so incredibly proud of the legislation that we were able to pass this year, and the legislation with bipartisan support, which is pretty remarkable. A total of 200 bills patroned by House Democratic Caucus members passed the House this year, and our bills focused on strengthening public education from the littlest learners to colleges to universities. We passed bills with bipartisan support that address food insecurity, protecting our environment, increasing access to affordable health care, and so much more. And many of these bills are on their way to becoming law on July 1. But I must admit, I was absolutely stunned to see this week, a couple days ago, that several important bipartisan bills were actually vetoed. Again, substantive bills impacting Virginians' lives with bipartisan support vetoed. And as I said earlier this week, I truly believe that these are petty actions of a governor that is more focused on sowing partisan division and grabbing cable news headlines than focused on delivering actual results for working Virginia families. So from day one, we have seen Governor Youngkin has focused his attention on seeking to divide rather than working together, rather than focusing on improving the lives of Virginians. And just for perspective, for those of you on the call, 6 of the 10 House bills that were vetoed actually had the support of over 2/3 of the House of Delegates. And in fact, 2 of those bills actually passed unanimously, meaning not a single Republican member of the chamber opposed those bills that were later vetoed. None of these 10 bills had less than 57 votes in the House, yet Governor Youngkin took the vindictive action of striking them down. Today, I'm joined by 3 patrons of the bills who will speak exactly to what some of those vetoes actually mean, what they mean not just to them, but to Virginians in their districts and across the Commonwealth. So first, it's my distinct honor and privilege to turn it over to Delegate Nadarius Clark from District 79 in Portsmouth. Delegate Clark.
Thank you, Madam Leader. Yes, HB 573 was an amazing bill. It was for medical debt relief. It would have put a statute of limitations from 5 years to 3 years on hospitals and collection agencies. But the great thing that it also would have did, it would have put limitations on the Commonwealth itself, which would have been the first of its kind. So that way you don't have to 30 to 40 years later in your life, you don't get a lien or a garnishment. And we know that medical debt is one of the top reasons for homelessness in Virginia. So we had bipartisan support on this bill. It passed the House 87-9 with 1 abstention, and it passed the Senate unanimously. We worked with numerous organizations such as the Virginia Poverty Law Center. We worked with the Legal Aid Justice Center, and we even worked with the Attorney General's office to make sure that the administration will favor this bill, and we can also get some productive work done to help everyday Virginians. And sadly, the governor still vetoed it, even in coming out of a global pandemic that we're still in. So this is something that Virginians needed. This is something that my district needed. This is something that the governor actually campaigned on. So it's sad to see that he has not kept his promise that he will allow Virginians to continue to suffer in medical debt as we come out of this pandemic. And ultimately, we should just make sure that we are following along. I'm going to push to override the veto. I hope that my colleagues on the other side of the aisle will keep their same stance, that they will vote the same way that they did the first time, and that they will not be bullied by the governor to change their votes. So thank you again for having me to be in this opportunity to speak. And I want to pass it to my good friend and colleague, Delegate Sia Price.
Thank you, Delegate Clark. I introduced House Bill 802 in direct response to unconscionable living conditions that some of the constituents of the 95th District in Newport News were being forced to live in because of slumlords. As I began to talk with other legislators, of course, it was clear that this was happening all around the Commonwealth. These residents were paying their rent, but were not able to get their concerns met or their work orders fulfilled. Right now, localities typically only have about 2 options to try to keep these renters safe in the face of slumlords. One is fines being levied by the court, and the other is for the locality to condemn the property. So what does that look like? Imagine you have a leak you need fixed because water is coming through your ceiling and ruining your furniture and carpet, and you have to deal constantly with mildew and mold. Your child has asthma and is getting sicker because of the living conditions. And then the only two options that are available for your landlord to be fined, which may be cheaper than the cost of the repairs and a disincentive to fix the repairs, or the property gets condemned and now you have nowhere else to go. This is a very real and common scenario in some of the apartment complexes I visited. Neither of these scenarios help the renter. So what House Bill 802 would do is allow for the locality to sue the slumlord for the actual fixes. And this is to issues involving health and safety standards. So meaning that the minimum health and safety standards are not being lived up to. So again, we're talking about leaks, mildew, mold, insect infestations, rodent infestations, etc. This bill would have been a game changer. And that's why we had about 40 organizations speak up in favor of it. And tenants were lined up virtually to speak, so many that public comment had to be cut short. And this common sense measure passed the General Assembly with bipartisan support, even with one Republican senator wanting to help make it even stronger against the slumlords. But once it got to the governor's desk, he responded to the needs of residents all across the Commonwealth in these horrible situations with a slap in the face with this veto. His response was that the bill is not needed and that these powers are already possible. He then went on to imply that the residents we are trying to help were somehow at fault for causing this situation. This is not based in fact or lived experience from the perspective of the renter, slumlord, or locality. House Bill 802 was a collaborative effort with attorneys who work in this field and advocates on behalf of both tenants and landlords. There was an overwhelming consensus that slumlords should have no place in Virginia. But with this veto, the governor is creating a safe space for slumlords and keeping the inadequate choice between fines and condemning properties as the only tools for localities, neither, again, of which help the actual tenant. Our intent was to provide a better way to protect Virginians who rent their homes across the entire Commonwealth against slumlords who were not holding up their end of the bargain, even while being paid rent. And that's what the governor vetoed. Next, we will hear from Delegate Patrick Hope of the 47th District to talk about the important legislation that he proposed during this session.
Thank you to my friend from Newport News. It's good to be here with all of you, and thank you for your interest in this. I'd like to discuss a bill, House Bill 675, which the governor vetoed on Monday. And if you're keeping score, the governor's vetoed 4 of my bills, but I just want to keep my remarks to House Bill 675 today. This bill was the unanimous recommendation of the Bipartisan Joint Commission on Healthcare that studied this issue and took extensive public comment over the summer and fall of 2021. This bill specifically would have eliminated a provision in Obamacare that allows health plans to charge up to 50% surcharge to tobacco users versus non-tobacco users. The Affordable Care Act gives states the option to remove this penalty, and that's what this bill seeks to do. The penalty is especially punitive, particularly for low-income Virginians, because it's calculated after the federal subsidies are applied and charged directly to the consumer. Some of you may know that people with low income are eligible for federal subsidies, and this hurts them especially hard because it's after those subsidies are applied. Now, by way of background, you might ask yourself, why is this penalty in there in the first place? Well, the drafters of the Affordable Care Act thought that the penalty would serve as an incentive for individuals to quit using tobacco products. But our studies have found, and the Joint Commission on Healthcare's research confirmed, that the tobacco surcharge does not promote quitting and acts as a barrier to coverage, especially for low-income Virginians. And this is having a snowball effect in our insurance market because tobacco users are choosing to purchase the coverage are likely to already be sick and to be very heavy users of our healthcare system. The people that are not buying health insurance that are tobacco users, they're not sick. And they're not chronically ill, and they're mostly young, and they're not in need of healthcare services, and they're willing to forego this healthcare insurance. The governor said in his veto message that requiring non-tobacco users to cover the increased healthcare costs associated with tobacco use is not the policy that he can support. But that is exactly what's happening right now. I really wish the governor had come to us with any questions that he or the administration had, that we can walk him through the insurance market and how it functions. The Joint Commission on Healthcare staff did a terrific job in putting this study together and doing the research, and we would have happily answered all his questions that he had. Well, the Joint Commission on Healthcare modeled the elimination of the tobacco surcharge. We used an outside organization, well-respected, the Urban Institute, and the estimate that they came up with is that in addition to reducing the premiums for tobacco users by 50%, it would cause premiums for all Virginians to fall by 4.5%. They would increase the number of the individual market enrollees by up to 13,000, and it would reduce the number of Virginians uninsured by 14,000 people. And so when you think about lowering premiums for all Virginians by 4.5%, I just looked before coming on here, the Kaiser Family Foundation averages the bronze program for Virginians for 2022 premium to be $343 a month. If this bill becomes law, it would save every Virginian an average of $15.44 a month over the course of a year, $157.78 a year, the average Virginian would save if this bill became law. And the last point I want to make before I hand it over is this surcharge is particularly hard on low-income rural Virginians. I know we have some reporters here from rural Virginia, because rural Virginia has the highest rate of tobacco users, and they also have the highest rate of the uninsured. House Bill 675 would close that gap by making insurance more affordable. And what Virginia family can't use an extra $158 a year? With that, let me hand it over back to our leader, Phillicorn.
Thank you so much, Delegates Hope and Price and Clark. Thank you for being on today. Thank you for your leadership. And thank you for sharing with everybody on this call and public what this means, not to you, but for Virginians, and how Virginians are affected as a result of these vetoes. So I can just add before you open up to questions. I have personally worked with governors from both parties since I was elected to the House in 2010. And what we are seeing, the actions we have seen from Governor Youngkin, is far from business as usual. And there's no doubt in my mind, and the members of our caucus, and probably outside our caucus, that Virginians will unfortunately pay a heavy price for Governor Youngkin's petty actions.